Day 9th of July. I arrived at the ambulance station around 7:30. We left with ambulance number 26, but with the same suitcase number 30. I was with two paramedics and the driver and another Russian student. On the way to the center on highway, the paramedic Andrei started to explain to us students the material that are inside the suitcase and also about the electrocardiogram suitcase, explained to the procedure. Our first call was around the 9:04 a.m. We arrived at the patient X house. The first paramedic asked the wife for the documents to fill out the registration. The patient was lying on the sofa in the prone position with difficult breathing, and his blood pressure was high at 220. And 2 weeks ago, the patient had surgery, and during the surgery, he needed resuscitation. And the patient was breathing very weakly. And the day before, he didn't get out of the bed, but today he woke up impatient. He was fasting. No fever. Makes use of insulin 10 units. He has a diabetes, and gangrene in both feet. Conditions was critical. The patient also had a historic of infarction in the year 2016. The patient was obesity and height. We waited a few minutes and received the second occurrence around 2015. We waited a few minutes and received the second occurrence around 12:15. When we arrived at the place, the patient mother was very scared. The patient was passed out on the floor and did not respond to calls. It was then reported by the mother that the patient had worked 24 hours the day before, and when she arrived at the night and had taken something. So the paramedics asked to see the glass she was drinking, and when the paramedics smelled, he realized it was samagon, alcoholic drink. So he put ammonia on a cotton ball and passed in through her nose, but the patient didn't respond either. So after releasing that the patient was in alcoholic coma, the paramedic asked us to go to the ambulance to get the hammock to take her to the ambulance stretcher. So we took the hammock, and she was taken the ambulance. Went toward the BCMP hospital, accompanied by the patient's mother. And we left her at the hospital and went to the central. We stayed at the central for a while, and we received the third call around 2:45. We went to the patient's house, and when we arrived, she was very weak and lying on the couch. It was reported that 3 years ago, she collected spinal.
Yes.
We went to patient house, and we when we arrived, she was very weak and lying on the cot. It was reported that 3 years ago she collected spinal fluid for analysis, and her professional it's a semestress and it interfered with her back pain. The paramedic palpated her back and the patient felt a lot of pain. The paramedic asked if I wanted to administer the medication to the patient, and I said yes. The patient had already been medicated with Gitarol some time ago, but it wasn't resolved, so the doctor sent an arguing about an arguing would be better. I started by opening the sterilizing syringe with the needle, fitting the two parts together and sucking the medicine. After the R was removed, I disinfected the site for an arging application. It was an intramuscular injection in the gluteal region. So after, the doctor recommended that the patient stay at the rest and seek a specialist for the burial treatment. We went to Central again. So the paramedic asked what the patient had eaten, and he said milk, melon, and mushroom. Talk to the patient. The paramedic said that the ideal would be to take him to the hospital for a better analysis, and the patient agreed. The quick COVID test was then done, which came out negative. The paramedics told the patient's wife that it could be gastric or possibly pancreatitis. So we drove the ambulance and went to the BCMP hospital. We left the patient at the hospital and went to the central. So this is all day.